Hi everybody, I'm Dr. Alejandro Castro and welcome to another video. Today we are going to discuss a very interesting condition in puppies that can often catch new grads and veterinary students off guard. But before we dive into the case, I want to share a helpful tip for exam preparation, especially for those of you studying for the NAVLE. When I was taking the NAVLE, one thing that really helped me with those tricky questions was highlighting. It's simple but effective because if you are going back to review a question, you don't need to read the entire thing again. You can just focus on those words to remind you of the key points of the question. Now, don't highlight every single question. You don't want to waste time on straightforward ones, but for the complex questions, highlighting can save you precious times, trust me. So, okay, let's apply this approach to the case we are reviewing today. So, we have a 3-month-old golden with a sudden onset of lethargy and painful swelling around the face and muzzle. The puppy is indoors and up to date on vaccines. On physical exam, you observe erosions and crusting lesions on the face and enlarged submandibular lymph nodes. A cytology shows pyogranulomatous inflammation with no bacteria. So this is important. The owners are healthcare professionals and mention they have leftover amoxicillin at home. This is something that can happen to you in practice. They ask you for the appropriate dosage to treat the puppy. What are your thoughts? Here are the options. Pause the video if you need a moment to think about the answer. Now you might be like, oh, I'm going to flag this question. So go ahead and highlight important information. This is what I would do. Okay, are you ready for the answer? So the correct answer is B. Steroids, not antibiotics, are indicated in this case. Now let's see why. So option A is incorrect because while amoxicillin is generally safe for puppies, it's not the right treatment for this condition. Option C is also incorrect. This is not a fungal infection. The cytology shows pyogranulomatous inflammation with no bacteria. There's no evidence of bacterial infection or fungi, so that's not correct. The option D contains a common misconception. Vaccines do not inactivate antibiotics. The reason antibiotics are not indicated here is due to the immune-mediated nature of this condition. So steroids are needed to reduce inflammation and treat the underlying cause. That's why B is the answer. So this condition is called puppy strangles or juvenile cellulitis. It's an immune-mediated disease, not an infection, seen mostly in puppies less than 4 months old. The common symptoms include facial swelling, pustules, and lymph node enlargement. Puppy strangles requires treatment with corticosteroids, not antibiotics, unless there is a secondary bacterial infection. And something important is informing the owners about the correct treatment and explaining why, for example, their leftover amoxicillin will help, is key in this type of situations in daily practice. Okay, well, I hope you find this video helpful. Good luck in your exam preparation, and remember, highlight the important details when needed, but don't overdo it. Time management is critical during your exam. See you next time.